Hey everybody, Taryn Quinteri here with Cosmetic Aesthetics. So I'm here to talk about ProCell Therapies microchanneling. I'm going to show you guys how I do it, how I set up my technique, and I basically am doing this because there's some misinformation out there, a lot of confusion between different devices and this and that, and then some newbies who just got ProCell, and you know how it works in our industry. Just a lot of information going around, not enough regulation. I'm not saying that everyone else doing it different than me is wrong by any means. There's multiple ways to get to every answer of a math problem. So it's the same with this. Okay, so I'm going to show you how I do it, and I hope that this helps you guys, not only my clients, but everybody in the industry. So I have already set up some stuff. I'm going to go over it a little bit, but I do have a setup video already on my YouTube and also on my Facebook videos. So if you guys want to see how I set up for tattoo procedures, or microneedling, anytime I'm working with blood, go ahead and go to my YouTube. But just to go over things, so this is a dry cleaning bag that I put on my chair first for extra protection. Some people use saran wrap, whatever you want to use, that's fine. Second thing I'm going to do is I'm going to put on, this is like a hospital sheet, medical sheet, whatever you want to call it. I forget what I type into Amazon to get them, but if anybody needs help finding them, you can just hit me up and I'll send you the Amazon link. Oh, actually my box is up there. So Deal Med stretcher sheet, and I get the 40 by 90. There are different sizes, so you might need to try a different size, but so it has the poly paper, sort of like a dental bib on the inside, so it is absorbent. Not that I don't get a ton of, I don't get any blood splatters with microneedling, but this is the proper way to set up for any type of procedure when you're working with blood. So in Arizona, this is not regulated. I by no means have to do any of this. I'm doing this because this is what you should do. You should treat everybody like they have AIDS, everybody like they have Hep C, right? So Hep C can stay alive for 2 weeks outside the blood, guys. So if I don't wrap my light, which I was gonna go over next, the shower cap, barrier film, the switches, and then I just move it like this, so make sure everything's covered. If I were to touch that without it being wrapped, touch my client's brows or face, and then touch my next client's brows or face and the light, and the first one had Hep C, there you go. Okay, so that's my chair. As I went over that, I've got this. I'm probably not even going to use this, but I wrapped it just in case. This is how I wrap it for tattoos because I need lots of light with my tattoos. With microneedling, I'm probably not even going to move this light, but I take press and seal, so it's next to saran wrap in the grocery store, or you can buy it online or whatever. I wrap the on and off switch. I wrap the knob, which moves this up or down. I wrap this so that when I'm moving it up or down, I touch it here. And then this is barrier film over the cord as well, so if I need to move it. Okay, so that's that. And then I'm gonna go over, so when you're working with blood, you need to have a surgical grade stainless steel tray. This is a non-absorbent metal. Behind me is my back workstation. This is an absorbent. This is a porous metal, meaning it cannot be 100% sterilized, okay? So this is stuff that I will not touch when I'm working with blood. If I need to touch something back here, I will deglove, okay? So I don't touch that tray. This tray is my work tray. Anything bloody rags, anything like that, it's gonna be on this tray. So first I put a trash bag over it, just again, sort of like this, for extra protection. Then I'm gonna put a medical, like a hospital, whatever you want to type in, there's lots of ways you can find them online, pillowcase. So same deal as the sheet, poly paper on the inside, absorbent on the outside. And I like to have my tray with the legs on the side. A lot of people have a tray with the leg in the middle. In that case, you wouldn't be able to use the pillowcase. You could use the trash bag, tie it over the middle stand, and then you would put a dental bib on top. So however you guys want to do that is fine. But just make sure when you're working with blood that everything is by the book. Okay, so I'm going to be using my MD ProCell device. For those of you who don't know, there are two devices. There's a silver one and a black one. They're both really great. Both get the same job done. This one's just a little bit stronger. You don't have to be an MD to use it. That's just what they named it. Okay, now this is just a spray bottle bag. It's actually used for these guys, but I put press and seal on this and I just prefer to. But this is a 6 by 10 inch spray bottle bag. It fits perfectly over the ProCell device. Now, something, a little tip for my people who already have ProCell. There is a little bit of plastic in here from this, and I'll show you how that happens, from my last procedure. So I'm gonna get in there with some, just like that, Q-tips, and I actually need to grab a pointier pair because it looks like there's some a little bit further. So you always wanna kind of get that out, make sure you're not stacking up too much plastic in there because you can damage your machine. Looks like I haven't cleaned it out in a while. There we go, now it's all clean. Okay, cool. So now we're gonna slip the bag on, and it fits on just like that. And I have already washed my hands, guys. I know some of you are seeing my nails, and I don't have a hair cap on, and hair and nails harbor tons of bacteria, yada yada. I can guarantee you my hair's not going to touch her, neither are my nails. So I did wash my hands before I prep, and I will put gloves on as soon as I am opening skin. So it fits on just like that. Then I'm going to take some of my tattoo grip tape, just like I would wrapping my tattoo machine. And the battery is already on, guys. So let me show you something real quick. Let me move this. Okay, if you can get the camera back there. So that is the charger for the batteries for the ProCell device. They come with a charger and 2 batteries. And see how that light is red? That means that it needs to charge. When it turns green, it's charged. They charge very quickly, and they last about 2 hours. So you can always get through a procedure, and you always want to have one charging while the other one is in. That way you are, you know, you never have a dead one. But if you do, that cord is actually really long, so you can plug it in. But as you saw, that cord is wrapped in a wire tie because I've never once plugged it in. My batteries do not die. So the battery is already on it, like I said. I'm just gonna go ahead and not be able to rip it because I'm on camera. And there we go. So that is set now. Okay. I've got out a couple of things, and I dropped it on the ground. Okay, this is a little spray bottle full of 100% pure aloe vera juice. I get it from Whole Foods, Sprouts, and I know you can get it online too. Make sure it's 100% pure aloe vera. I give this to them along with some Aftercare. They can use this. Now, this is my advice. This is not medical advice. You do what you feel comfortable doing, what your insurance covers, okay? But aloe vera has been used on open skin and burns for, I don't even know how long, forever. So I give them aloe, and it's actually, I keep it in the fridge so that they can spray it periodically to help with the kind of sunburn, stinging feeling that they're gonna get from microneedling. So I give them this with their Aftercare. This is a little hyaluronic acid mask that ProCell sells. I'm sure you can get them elsewhere too, but they have really great pricing. So, and it's just to use immediately after treatment. So ProCell's serums are made of hyaluronic acid and human stem cell growth factors. The stem cell growth factors are derived from healthy young individuals. They've got to pass a ton of requirements. I guess that's the new thing these days. I'm too old to do it, but people are selling their bone marrow. So it's a really painful procedure. So anyway, that's where those come from. But this is hyaluronic acid. So I recommend not putting any like Aftercare products or any kind of mask on immediately after microneedling unless it's just hyaluronic acid, because hyaluronic acid is already in our skin, so in our bodies, you can't have an adverse reaction to it. So that's why this is safe to use immediately after, and it's very soothing. Another thing I do, but I'm not going to include it on the film because it would take forever, is if they have the time for it, and I use it as an upsell so I can make more money, I'll put my little Saluma LED light on them, LED therapy, and that really helps with the redness. So if you've got that client that's like, oh, how long am I gonna be red? Like, most people are red for a couple hours. Some people like me, I'm half Irish, I'll stay red for like 24 hours, but the next day it's more of a pink, and you can put makeup on the next day if you so choose to. So for those clients who are like, oh, I have a dinner to go to and I can't be red, get yourself an LED light, and it's a good investment. It will really help with that. Okay, so that's gonna be for later. I have got out okay, and I dropped one, that's okay. I've got out a little gauzy, and that I'm going to cover with my membrane. This is just membrane tonic diluted with a little water. I am a distributor if anybody needs it. And this is what I'm gonna use to wipe the numbing off. Okay, so I'm gonna put that there. I've got my tip here. I'm gonna start off with a 0.25 on the model today. She's got white skin, so I should get a pretty good response from it. If not, I'm gonna up it to a 0.5. I love using 0.5, but we're gonna do the 0.25 on her because she's got sensitive skin. This is the little serum I was talking about. This little guy will cover a whole neck and a face. If you're going to do the décolleté and sometimes the hands, I package the décolleté and the hands together because you will need an additional vial to get the décolleté and the hands done. But this will cover from here up. Okay, so that's that. I can put the tape away and we can go ahead and get started. So I'm gonna have my client come in and sit down. I'm gonna grab a little something in here. Yeah, let's grab another gauzy. Let's grab me some gloves. Okay, I've got my gloves. And I need my apron. So again, you guys, I know in our industry, and it's a good thing, a lot of people like to be super safe, like wearing like surgical gowns and hair caps and all that stuff. To be honest, like we're really not working with a ton of blood with ProCell. That's the great thing about it. That's, you know, it's less downtime. It's not, you know, we're not doing open heart surgery. So in my opinion, you don't need to do all that. You do want to be careful your hair doesn't touch their face or their hair doesn't touch their face, because as I said before, hair does harbor a lot of bacteria. And then if you are one of those people, I'll go over it again when I get to the time, but that, you know, kind of like leans your, which you shouldn't do that, but if you are one of those people that leans your arm on their forehead, then yeah, you will want to wear some kind of like a surgical gown, okay? Or you can get the extra long gloves. Another thing I want to talk about is gloves. So your gloves should not be too thin, like, you know, like no lunch lady gloves. You want to get heavy duty nitrile exam gloves, medical gloves, tattoo gloves. Make sure they are heavy duty, because there are times, such as when I'm doing her nose, where the tip won't be completely flush, and that'll make sense when you see it. But in that case, you might accidentally, you know, prick your finger. If you've got, now I'm using like a 0.25, even at a 0.5 is hardly anything, but it could go through a glove. So you don't want to prick yourself with somebody, you know, somebody else's blood. So if you have heavy duty gloves, you are in the clear. I'm gonna go ahead and lean her down. You want to bolster under your knees? You sure? All right, and let me know if your back starts to hurt. Usually I would wear a face mask, mostly for my breath. I don't want my breath to smell in their face, but also because I don't want to breathe their breath. But she's my friend, not worried about it, and I'm on camera. So I do have those little clear face masks, but I'm not gonna use it, not worried about it. Okay, so let's go ahead and start. Now, how I've got her numbing. I had her numbing, her pre-numbing, so it didn't take forever with this video. And I'm actually only going to do like a little bit of her neck. I'm not going to do her full neck because I don't want to take too long, but I am going to show you guys how to stretch it properly at least. Okay, so the way that I numb, I usually apply it to the whole décolleté, neck and face, whatever I'm doing it for them. I put saran wrap over it, and I do it very specifically. I do like one piece, maybe about 6 inches by 10 inches or so, and I put it on just half the face. Then I put the other piece on the other half of the face, and I just kind of crack a little bit so that they can breathe, obviously. The reason I do that is because I often hear people saying left side hurts worse. Such as, you know, when I'm doing brows, eyeliner, anything, it's always the left side hurts worse. So basically I'm going to start with the right side. I'm going to remove the numbing from only one side and let this side keep numbing. Okay. Another reason I like to do one half and then the other half is it's a good little kind of like sales pitch. So it, you know, I'll do one side of their face and neck, and then I'll sit them up and I'll give them a mirror, and I'll be like, oh, you know, look at your crow's feet, look at your nasal labial folds, and they get all excited because it does swell you up a little bit. So it's kind of like a preview. I always say this is a preview of, you know, the results. You know, the cells are going to take 21 to 28 days to stimulate and grow before you start seeing the real results. But I have never had so many amazing before and afters of just 1 to 2 treatments as I have since I started using the ProCell device. If any of you want any of those pictures, go ahead and let me know. I also have a Facebook group. It is for my clients only. So far, maybe one day I'll change it, but right now there's just way too much like different techniques going on from different people. So it's just for my clients only. If you are my client, you don't know about, if you're not in the group, let me know and I'll add you to the group. We all post pictures, we ask each other questions, we let each other know, you know, what needle we used and how many times, and it's really, really cool. So okay, and you know what? I think I am gonna go ahead and put a little hairnet on her, just because I am touching her hair just a little bit. Let's see, where do I have some back here? All right, go ahead and lift your head for me. There we go. Good enough. Okay. See, even the hairnets, you're never gonna get it perfect. Still hair showing, just saying. Another thing, you guys, I've got my gloves and stuff. I'm working on getting a paper towel a little bit. My gloves are, you know, hanging up so I don't have to like be touching the box all the time. I'm very careful with my paper towels. I don't touch them. I rip one off. And anyway, but I am getting one of those touchless paper towel dispensers. It's not required in Arizona, but I want to get it. A lot of big changes coming in our new office. Stay tuned. Okay, so now let's talk about how to load the tip. So you could peel it up like a Band-Aid. I like to just pop it open just like that. Now it's got a little nipple, if you will, and this has a hole. Sounds dirty. So we're gonna pop that in the hole just like that. Now, you guys, this is very important. When you are done and you are taking the tip off, do not pull it directly out or up or whatever. That can actually damage the machine. Now, good thing about ProCell is we do have a lifetime warranty, but if you've got back-to-back clients and you mess up your machine, that's your problem. Okay, so what you're gonna do is roll it off like that, okay? So, pop that in. I'm gonna go ahead and save the lid because, and now every state's different, but in Arizona, if it's under a 0.5, we can toss it in the sharps container, and truthfully, they don't care about microneedling or tattooing, so it's a mess. But anyway, so I can pop the lid on and I don't have to waste the space in my sharps container. I can throw it in the trash. Did I just originally say they could put it in the sharps? I don't know. Anyway, you can put it in the trash with the lid on. Okay, take the serum and let's go ahead and start. Does that mess up the view at all, this lighting, or no? Okay, great. So I am gonna show you guys how to stretch the neck as if I were starting from here, okay? So you can pull down. Now, normally if I were doing, like I would have her in like a facial robe, so I'm trying very carefully not to touch her clothes right now just because there could be bacteria. But, you know, sometimes you'll need to pull down. Basically what we wanna do is we want all of these wire filaments, okay? So for those of you who don't know, ProCell does not use needles. They use wire filaments. Those are small enough to fit inside of a hair follicle. It's what's used in electrolysis. So that's another reason, barely any trauma to the skin. So you heal, the downtime is very, very quick. So we want all of these to be flush. Now, see if I put this right over this little tiny neck crease she's got, it's tiny, don't worry. Little tiny neck crease, not all of those wire filaments are doing their job. So I wanna, you know, get rid of that crease. Now, sometimes I might need to pull it this way. So when I'm working on, let's say, her Eve's apple, right? If I just sit there and tap that, it's just gonna have to cough, right? So I try to pull that skin off to the side and then I work on it like that. Now, one thing for all of you permanent makeup artists, one of the hardest things that you're gonna have to brainwash yourself with is how you stretch, okay? So we are trained to go 1, 2, 3, right? And then do, 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 or 1, 2, you know, we're using a three-way stretch. We're using our fingers a lot when we're tattooing. So I want you guys to be conscious of several things. The neck, okay? Let me show you real quick. When you finger someone's neck, I know that sounds funny, I make everybody laugh. No matter where you press your fingers, something weird's gonna happen, okay? You're gonna hit their vocal cords, you're gonna hit, you know, whatever those are called. It's not good, it's not comfortable for them, okay? So you don't want to use your fingers too much. Now also with the cheeks, let's say she had cheek injections, okay? This is not going to be very comfortable. You're not going to, you know, probably not going to move their injections, but it's just not comfortable. It makes them uncomfortable. So sometimes you will need to use your fingers. For example, when I'm working on the lip, you need to, right? But what I would like you guys to practice is using your full hand. You can use this part of it, you can use this part of it, or you can use all of your fingers together. Look at the difference this makes versus that, okay? So that's uncomfortable. This is comfortable. Uncomfortable, comfortable. You see, so as often as you can, use your whole hand. Obviously, when needed, you know, use your fingers. There's sometimes when you're gonna have to, like for those little 11s, right? Okay, so we got that part out of the way. I'm gonna go over some do's and don'ts. Beginners, first mistake, it's not a gun. We're not holding it like this. This, we would lose a lot of control of your pressure and your depth, and you could, you know, could really hurt them. You're gonna hold it at the tip like this, okay? Second mistake, beginners like to go from point A to point B super, super fast. So they like to go, whee! Okay, this is so great. So I always tell people, imagine like, you know, like a silver dollar. For those of you in other countries, whatever your biggest coin is. So imagine a silver dollar and stay within that silver dollar. It literally, tons of overlapping until you get it nice and red, and you'll see because I'm about to start. Then you're going to overlap about 50% and move to the next silver dollar. You want to go very consistent with all of this. Reason why, if you're hopping all over the place, 2 reasons. You run the risk of snagging and tearing the skin. You run the risk of snagging and tearing the skin. And also, let's say you've had numbing on. So if you're poking here and then you're coming over and tapping here, you are awakening her skin. The numbing's gonna wear off. So you wanna really be consistent, keep the areas numb that are still numbing, right? Okay, let's see. Contraindications, herpes, cold sores, and Botox. No, herpes and cold sores are the same thing. herpes/cold sores, and then moles and Botox. Those are going to be your main contraindications. There's not a ton of contraindications with this. Those are the main 3. You can literally move someone's Botox if you do it too quickly. So I have them wait 2 full weeks. Okay, Botox injections 2 full weeks after you can do microneedling. Moles, always go around them. They will be able to tell that you went around them because they will be white. All the skin is going to be pink, nice and consistent, but around the moles, they'll be white because you're going to go around them. Okay. This can work on active acne, but very, very specific technique. We'll go over that another time, make a video on it. If you're not an esthetician, I don't recommend it. Send them to an esthetician to get their acne cleared up. Then you can help them with their acne scarring. Let's see. I think that's about it. With cold sores and the aloe vera juice, I skipped this earlier. In my paperwork, which I'd be happy to share with you guys, I have them mark that they understand that if they have ever had a cold sore, they either need to let me know to go around their lips, or they can just start taking their medicine a couple days in advance. I don't say, do you have herpes, yes or no? I don't care. Just mark, just sign it that you understand that's the rules, okay? That way, because a lot of people are gonna lie to you, right? They're not comfortable telling you they have herpes. I also have a box that says, do you have an allergy to aloe vera? As long as they check no, then I'll give them that little spray to soothe their skin. And I think that's it. Oh, it's back to the moles. So whenever somebody does have a mole, this is a freckle, this is not a mole, but let's say it was a mole, I would go around it. I would also photograph it in her before and after, and I would attach that photograph to her paperwork. And I'm gonna mark like mole on left cheek. You just always wanna like document yourself as much as possible. When I'm doing it, I would tell her, okay, so I'm going around the mole on your right cheek right now. I'm gonna voice it out to them, okay? Those are all very important things, just ways to not get sued. Now, I'm gonna try to talk over this. Every now and then I'm gonna have to turn it off because it is super loud. The MD machine is very, very loud. The Pro is not as loud. So I have both. I think I like this one because it gets the job done quicker, but for some, let's say, elderly people, it might scare them because it almost sounds like a power tool going into your head. So that's the slow setting, guys, and that's the fast setting. So I'm gonna go ahead. Sometimes I'll start them off on the slow so they can kind of get used to it. I'm gonna start on her chin. Normally I'd be on the neck. This is gonna be my first section. The chin, middle of the chin, all the way over, all the way behind her ear, guys. If you're gonna help somebody with their, tightening their neck, you see these tiny little wrinkles she's getting? I want to get rid of those, right? So I'm going to go all the way behind the ears. Usually, I'm in a hurry today, but usually I would have her even take off her earrings and I would just stretch her earlobe. And here's another reason why you need those heavy duty gloves, because your finger's sort of in the way. And I would go right over her earlobe to tighten that. But today we'll do this section and we'll go behind. Okay? Let's go ahead and do this. All right, so in the chin, sometimes you have to have them put their tongue in there. Hers, she doesn't have a butt chin, so I'm just gonna go ahead and I am gonna use 2 fingers with this, being a hypocrite again, but I'm just gonna go ahead and stretch her skin. Now, you also need to contour your device with their, the contour of their face. Let's close that on all the way. So see how there's a divot in everyone's chin? I want you to pay attention to the position of my machine. When I'm working on the bottom of her chin, it will be here. When I move up here, it's gonna be here. So remember, we wanna keep all the wire filaments as flush as possible. And that's why you really gotta contour with the skin. So another thing beginners do, and I'm gonna do it to her because she's my friend and because it's a 0.25 tip, so it's really not gonna harm her, it's almost impossible. Beginners like to go like this. Now I want you to listen. You tattoo artists know what I mean by listen to your device. That's what's going to give you clues if you're doing something wrong. This is wrong. Okay? Because this is moving up and down. You want a very consistent up, down, up, down, up, down. This is the right noise. You hear that? Now you might go slower than me, you might go faster than me, whatever the case. Make sure, another mistake beginners do is this. I'm not going to really do it, but okay, don't bounce too high. The key is stay low to the skin. Okay, straight up and down. Now see how I'm kind of moving around in like a tiny little circle, but honestly I'm hitting that same spot over and over and over again until I get a little bit of pinpoint bleeding. Now for those of you in California that are estheticians and not tattoo artists, I do recommend you get your tattoo license. Unfortunately, it's very easy to do. That way you can use above a 0.25. If you're an esthetician, you can only use a 0.25 and you actually want to just do it until they're pink. You don't want to get any pinpoint bleeding because you're not allowed to, if I'm not mistaken, you're not allowed to draw any blood. You're supposed to only get like the epidermis if you're an esthetician in California. So I am going directly over her lips, if I remember correctly, right? You've had them tattooed, no cold sores. So yeah, we're gonna go directly over the lips. Now she has filled out paperwork in the past. Usually I try to get people to re-look over their paperwork every time, and I have a little section that says date and sign. If anything's changed, they need to update it when they come in and then sign it and date it. But she's my friend, so you all know how that goes. So the truth is, the great thing, and what a lot of people don't realize, you can get the same results with a 0.25 as you can with a 0.5 or even a 1 millimeter. You're not going to get them as quickly, meaning time today. I might even switch over to a 0.5 with her, I'm not sure yet. But we don't need to go deep. We used to think the deeper the treatment, the better, or the deeper the penetration, the better the results. That's been proven to be false. 0.5 is my go-to. I love the 0.5. It gets the job done quick results. Only time I ever go above 0.5 is when I'm working on like a serious like cratered acne scar, so it has to be deep enough to get in there, or if I'm working on a surgical scar, so a tummy tuck, a breast reduction or cancer, any kind of surgical scar. If they've healed like hypertrophic, like they're hard, then I'll use a precision tip, 1 millimeter. So what that means, this is a face tip. This is the medium one that we have. It has 25 wire filaments. Our precision tip is smaller, and it's got 12 wire filaments. And then we have a body tip, which is awesome for stretch marks, loose skin around the stomach or the knees or even the elbows and arms. Awesome. And it has 50 wire filaments in it. I think, let me do a little bit more. I might switch to a 0.5 on her just to make this video go a little quicker. Now, I do not apply the serum first. I apply the serum afterwards because I need to be able to stretch her. If you apply it first, you're gonna have a hard time stretching her, okay? Now, you don't have to go, as hard on the lips. They're very thin tissue, so just a little bit. Okay, I'm gonna go ahead and get a different tip out, guys, just to make this video quicker for you. Oh, where did that little box go? Now this tip is gonna look a little different. ProCell just got new manufacturers for their tips, and they are so much better. They're smaller. I mean, they still do the same thing. I guess they're just more convenient, especially for those of you that need to put it in a sharps container, if that's your state laws. This will obviously take up less room. I'll show you the difference here. Now, for some of you like who are estheticians, you can start them out. A lot of people will just want to like get the procedure done quick. A lot of your clients want that. You can totally just alcohol their skin. I have them come in with no makeup, no mascara, nothing, and I'll go over that why when I get to it. But I like to usually cleanse and tone their face, like they're about to get like a facial, you know. And if they have acne, I'll do actually like an exfoliation with steam. Then I'll do extractions. Then I'll put the numbing on. Again, don't do that if you're not an esthetician. And if you are an esthetician, please contact me on the technique because you can spread bacteria. So yeah, but anyway, new tip. All right, so again, guys, peel off, not pull on. So look at the difference between these guys. Isn't that great? So, and they have a little cap that protects the wire filaments, so you don't have to worry about them getting damaged or anything like that. Okay, so here we go. So this is a 0.5, so I'm doubling it. And watch how much quicker I get this response. See that? I've already got some pinpoint bleeding. See that contour, guys? Switch it up. Alright, I'm going to go ahead and use my fingers for the corner of the mouth. This is a really important area. So you want to get rid of those jowl lines. She doesn't have them yet, but we're going to prevent them. Alright, and then we're going to go ahead and do the upper lip. Okay. Now this is one area, sometimes I'll do the whole thing just because if we kind of awaken it over here and then we go back to do the other one. The lip is usually the most sensitive, but she is pretty numb right now. If they're on their period, guys, it really hurts them. I've noticed that I have really, really good numbing from my medical director. 20% BLT, all the canes but the cocaine. But it still hurts them when they're on their period. Also, if they're sick, I've noticed, I mean, generally if they're sick, they shouldn't come in anyways because they shouldn't want to spread anything. But sometimes people will come in like, oh, I just have a little cold, you know. Sometimes when they're sick, their body, it hurts them worse. So here, I'm going to go ahead and use my fingers because I feel like I can get a better stretch like that. I'm just not pushing. There's a difference between and, you know, so just be very, if you are using your fingers, be very gentle. So I'm going to go ahead here in a second and give her a little break for some serum. See how much quicker I got that response with the 0.5. Now it's probably because I've done her skin before because she is very, you know, white skin. And people react very quickly with the 0.25. But I think this might be the third session I've done on her. Maybe the second, third, I don't know. Anyway, her skin's probably gotten used to it, and that's probably why I needed the 0.5. Or not needed, again, I could have done the whole thing with a 0.25. It just was going to take me longer. So sometimes when you pull just one way, like I've taught you to, you might actually be creating a horizontal crease. I don't know if you can see that right there, but right there. So that's why I went ahead and I just said, oh, okay, I got to pull up a little bit, okay? Alright, I'm going to go ahead and give her a break, put some serum on. So what I love about ProCell is look at this this station. Look how easy that is. It's so not messy at all. Now you don't have to rub it, but I let that little sit there, a little blood spot. I'm gonna rub it in for her. Okay. So you can kind of like rub in the little blood droplets, whatever you want to call them, blood spots with the serum. Some people like to do this type deal. That's up to you, whatever you want to do. But you see how now I can't stretch? So that's why you kind of put it on as you go. And I know this looks like nothing, but seriously guys, there's so much in here. Okay, now we're gonna keep moving. And guys, I'm probably only gonna do half of her face just to save us time. So don't worry, if you're getting bored already, I'm only doing half. And normally when I'm not talking and teaching all this, I can get this done pretty quickly. Numbing, cleansing the face, numbing, all of that included. I usually get this done in about an hour. I'm in Phoenix. I charge $225 per session. Again, we are using human stem cell growth factors, not plant stem cells. So it is expensive, you know, our cost per procedure. So Phoenix is on the cheaper side of things. My girlfriend in San Francisco charges $400 per treatment. In LA, $500. In New York, $500. So, you know, location will affect how much you charge. But for me in Phoenix, I'm happy if I'm making $100 an hour. That's very, very good for me. So see guys, I'm literally going behind her ear. It all starts here. There's no point in doing someone's neck, although I'm not doing it today, but in doing it without doing here, because this is where it all begins. Some people don't like it, like the way it feels. I personally think behind the ear feels really good. So now I'm gonna go ahead and just stretch her skin right there. I'm gonna get this little teeny ear wrinkle. One of my clients, I think it was Eyelash up in Canada. I'll have to show you guys the picture. Her logo's on it. But anyway, she has sent me a picture, one treatment of an ear. She took the picture right here, just her ear. And it is the most awesome before and after. And like I said, it's literally one treatment, guys. So before and afters are key. The way that you don't just take them of the face, like take detailed pictures of this. If her main concern is her eyes, take a close-up of her eyes. If her main concern is the pores and the blackheads on her nose, take a close-up of those. So you see how I'm very careful? I'm not resting on her. Now this isn't open yet, but once I'm done with this side of the face and I go to do the left side, look what would happen if I was a rester. So her skin would be open and I would be totally touching it, okay? So I try to be as careful as I can to not touch the hair, not touch any of the skin. Again, this is a freckle, not a mole. So something that I want you guys to really pay attention to is, watch this. You see how her skin is giving? This is called give. That means you're not stretching enough. So sometimes like this, I feel like her skin's kind of given. So you know what? I am going to break my own rule and I am going to just use my fingers. But again, I'm not pressing. I'm just very gently stretching. But that way, you see the difference? You see how that skin's not moving? You're going to get the best result and the quickest result by properly stretching and the proper technique. Now, do you guys see how consistent this is and how white her neck is? So what's great about this is, again, if let's say this was a mole and I went around it, she would be literally white around the mole that way. And when people do have moles, I always take after photos, okay? Like immediately after photos, because I want, in case they try and say, hey, she gave me skin cancer, right? Or, you know, this mole stimulated into cancer. No, I didn't. Look at, this is you when you left my office. See how it's white? I went around that mole. So that's another thing to remember. And this is also a way that you can keep track of, oh crap, I missed that part. Look at it's white. So then you go backwards when you miss something, okay? So it's really, really awesome. So I'm gonna go ahead and give her another serum break. It's very soothing for them too. You know, they like these breaks. They're like, oh, thank God. I'm gonna do her whole face, by the way, guys. I'm not leaving her with half a face. I just meant on video. Yeah, that would be funny, like doing half their face just to like, as like a, you know, like do 3 treatments on half the face and then be like, look how good it works, you know, but they'd have half a wrinkly face. So I'd be willing to do it. You guys know me. Maybe I should do that. But no, I want to be beautiful. I'm going to do all my face. Okay, so I'm getting up closer to the eyes. Okay, I'm not going to go too close yet. That's a separate section. My next section is her nose, under the eyes, and all the way back here. So I'm going to go ahead and do her nose. When you guys are doing the nose, again, you want to try to have them flush and you want to contour with the skin. So how am I going to contour if I'm just going like that? I'm not, right? So I'm going to do my best to just maneuver the nose and work with the crevices, okay? Nose is really important, guys. There's a lot of blackheads and pores. You see that? So half of it's hanging off. Again, why you need heavy duty gloves, because what if I accidentally poke right there? No problem. Boom, boom, boom. Doesn't affect my glove. Now, this is a very important section too. I literally don't skip anything. I give such a thorough treatment. So I need to stretch that part because there's little teeny wrinkles in there. So I literally will stretch it. Now, the 2 areas, sorry, I hate screaming over this. 2 areas you need to be the most careful on people, in my opinion, is right here on the bridge of their nose where it's extremely bony, and right here. I'll get to that when I do the eye. But basically what can happen is you can kind of just nick them and it makes like a little red mark, like a little nick mark, and it lasts for up to like a week. So if you could, you know, try to avoid that. So what you want to do is I'll go to the slow setting on the Pro device, the silver one. You don't need to go to the slow setting. I actually never use a slow setting on that one. It's just pointless in my opinion. But I'm gonna lighten my own pressure when I do those areas, okay? Okay, now here I go on in here, very light. Okay. So don't skip this area, guys. It's all connected. That's what makes ProCell so great. Microneedling in general is so great. I'm sorry, microchanneling. I still say microneedling because people know what that is, but a lot of places, like, you know, are not allowing it now, like California. So that's why ProCell created this device, because this is technically not needling. It's microchanneling. We are creating vertical channels into the skin for better product penetration and for less downtime, rather than dragging needles, which are larger than wire filaments, through the skin. We're also using wire filaments, therefore we're not technically microneedling, although it achieves the same exact results. Better and safer. You can actually work on all 6 skin types. I'll be giving a speech in Atlanta, June 23rd, at the Permanent Makeup Women of Color Conference. They've only got a few tickets left, guys, so if you're interested in that, it's awesome. It's a whole continuing education conference that just focuses on dark skin types. You know, there's a lot to learn about ProCell on dark skin types. A lot of them will hyperpigment for a while. So anyway, if you're interested in that, there's only a few tickets left. Check it out. It's a 2-day event. It's super, super affordable. It's awesome. And again, we're going to go over lips. We're going to go over eyebrows, scalps, everything pertaining to just dark skinned people. So it's really great. That's kind of a subject that's just brushed over in our industry like it's nothing. Okay, so I'm going to give her some serum, and then I'm going to show you guys how to do the eyes. Now, while I'm doing this, I'm going to talk about the hair growth. I'm sorry for my sniffles. It's Arizona allergy season. So this treatment actually, or this procedure, treatment, whatever, can be done to stimulate hair growth, okay? So sometimes I'll go over people's brows if they want me to. If they have permanent makeup, it's not gonna harm it, but it will stimulate it to fade quicker, because what this is doing is producing new cell growth, therefore it's growing new skin literally from the inside out. It's awesome. So this can be done on the hair, which again is why, like, you know, You can put a hairnet on, sure, because the hair harbors bacteria, but I literally do this on people's hair. I use a 0.5 precision tip. For those of you who have questions on that, I'll be happy to answer them later, but it's a completely different serum. It's a hair serum. Don't do that on the face. And it's a different technique, but nonetheless, I am doing it over their hair. I have yet to have anybody have a reaction. It's a very popular treatment. So again, I don't really worry about the hair too much, but I did this because I'm trying to do everything by the book for you guys. Okay, so I'm going to the slow setting to do her eyes, okay guys? Now again, this is why you won't, if they come in with mascara on, you gotta use a makeup wipe, and then you'll wanna use OcuWipes, okay? OcuWipes are what optometrists use, and what I like to use before, and some states even require that you use it before tattooing eyeliner. So same thing, I use it because I'm not gonna do her eyelid, but I am gonna go pretty close to that lash line. So never ever should you guys be doing this area right here. You should not do their eyelid, it's too close to the eyeball. You can do up here, and I'm gonna show you how, and you can do down here. I'm about to show you how. So again, slow setting, adjusting my pressure. When I stretch the eye, I'm actually going to use my fingers. I'm going to pull down, but not just down, because if you look, see how I created vertical wrinkles, creases right there? So these aren't going to do their job. So I'm going to stretch down and then out. You see how that made that nice and smooth, guys? Okay, so now here's the deal. I'm going to go super, super light, and I just walk them through it. I say, okay, I'm about to do your eyes. You might tear up a little bit. That's very normal. It's just, you know, a reaction. See how close I am to that lash line, guys? It's awesome. So I kind of just coach them through it. All right, I'm halfway done, almost done. Then this area in here gets a little tricky, so I kind of will then grab the nose, just like that. I'm just very, very gentle with the contour. Now, obviously, if somebody's main concern was their eyes, I would use the precision tip, okay? And then I would charge them for, if they wanted their face and eyes, I would charge them additional for the second tip, because they are expensive tips. But I can pretty much maneuver with the face tip. So, but if it was her main concern, I would use a precision. Okay, so then I did it once. You see it's already got a response with very, very light. I'm gonna go ahead and ask her, are you okay if I do that one more time? Yes. Great, so we're gonna do it one more time. Let's start from the inside out this time. Now, sometimes I do use my pinky as a stabilizer, or the side of my hand, that's fine. When I'm working around the eyes, sometimes it's good. That's very awkward for some people. Don't attempt this. If it feels wrong, don't do it. Just be careful, okay? Almost done, great job. Awesome. All done. Let's go ahead and give her some serum, and then we're gonna tackle those crow's feet above the eyes, forehead, and then we are done for the day. Now be careful, don't get this in their eyes. I mean, it's not the end of the world if it does. It'll sting a little bit, but preferably let's not get hyaluronic acid in their eyes. So I just put in a little bit on, then I kind of rub it in with my fingers. Okay, so now we're gonna do the crow's feet. Actually, I just put serum there, so I'm gonna skip. We're gonna go here, and then we'll tackle the crow's feet. I already kind of got some of it, but now she doesn't mind. She's got some old permanent makeup in there from way, way, way back when. I've got to do a correction on her here soon. But so I'm gonna go right on her eyebrows. She had a treatment done. She had chemo done 8 years ago. What's interesting, she actually lost all her brow hair, and then from having it tattooed 8 years later, it grew back. So anyway, she doesn't mind if I go over. I'm gonna break up some of that old pigment, as well as stimulate some hair growth and tighten up that eyelid. Again, never on the actual eyelid. I'm going to pull all the way up, okay? And I'm gonna take advantage of that brow table. Just like for those of you who do permanent makeup, we're using the brow table, okay? Very, very gentle here, guys, because again, you can nick them and leave a little red mark. Now, if this were somebody that said, no, my microblading was just done, or my brows are just done, like I don't want the ink to fade, then I would maneuver this. So it's gonna look like I'm touching her eyebrows, but I'm not, okay? So this is how I would do somebody like that. I would get very, very close in, and I would just do half. I would maneuver it so that it's not quite touching her brows, but just getting that under section, just like this. Or on the flip side, depending on their eyelids, some people's eyebrows are higher, and you could actually just go like this, but you wanna have this tilted up so it's not hitting her eyelid, okay? So anyway, I like to do it tilted this way. And that's for somebody who has permanent makeup, and you gotta really get in there with your, with your eyes. but I'm gonna go ahead and go over her whole brow. Okay, crow's feet, guys. I am going to use my fingers again, gently, just because it's, you know, I want to pull both ways. So, contour. This is another, just like the chin, you see the position? Boom, 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 boom. Always contour with the face. Okay. Now, let's go ahead and get those 11s. Just like that. The forehead usually gets a pretty quick response. I am going to pay a little extra attention to these 11s because that, in my opinion, is really her biggest concern, although she hasn't vocalized that to me, but that's what I'm seeing in her skin, right? So I'm going to get rid of those. You see how I'm using my pinky as a stabilizer so that I'm not like, even though I could, because I've got gloves on, I'm not using my arm. But just be very conscious of where you're placing things. Now, what I like to do at the end of the treatment, so after I do this next side, is I like to actually do their hairline. Not necessarily, she doesn't necessarily need it, but some, like when you start getting older, or sometimes women after having kids, they can have, you know, hair loss due to stress and this and that. A lot of women have the most gorgeous, luscious locks after having a kid because of the prenatal vitamins and all that. But some people experience some hair loss, so, and men as well, obviously. So doing their hairline is kind of, even without the hair serum, any kind of micro injury to the skin is going to stimulate growth, cell growth, right? So it's gonna work. These serums just make the results, like I said, I have amazing before and afters from just 1 to 2 treatments. I've never had that before. I've been microneedling 7 years. And I used to get great results, but after like 3 or 4 treatments. So anyway, I do their hairline just as kind of like a nice little like, oh, by the way, you know, I'm gonna fill in your hairline, help it grow a little bit. They love it. Okay. Let's say that's good. Let's go ahead and give her some serum. And I'll kind of, I'm going to go over how I would clean up, but I'm not going to clean up because after this, I'm going to continue. Now, if you guys ever have any leftover serum, which sometimes you will, like if you're not doing her neck or whatever, sometimes I have a client that's like, I just need a quick appointment, you know, get me in and out, so I'll just do their face or whatever. I often see a lot of girls after they get their period, not while they're on it, but after, because they break out. And this is really, really great for like, literally I can get rid of pimples. Like they're just, you guys will have to message me about it, but it's so freaking cool. I lost my train of thought there, not gonna lie. Oh, if you have leftover serum, go ahead and use it all while their skin is open, okay? They say you have 90 minutes till the skin closes. Okay, so I try to like put serum on until I don't see those little pinpoint bleeding spots anymore. Sometimes you'll still have a couple, but so actually guys, this is great. See right here, see how this pinpoint bleeding right on her eyelid is not going away? That means I nicked it. That could be there for up to a week. It's not a big deal, doesn't hurt her, but that's what you can do if you're not being very careful. So it's probably because I'm on film and you know, whatever. She's fine. Okay, so let me just go over how I would clean up and then I'll finish the other half of her. So I'm gonna go ahead and put the lid on here, take it off like that. I'm gonna be very careful not to touch my device while I'm unwrapping it, okay? I am going to make a separate video of like how I clean up both microneedling and when I'm tattooing. The tattooing has a lot more cleanup, so just stay tuned for that video, because right now I can only tell you what I would do. So I would just be very careful not to touch anything. If I feel like I need to touch something that isn't wrapped in order to clean up, I would deglove and put on a new glove, or deglove and then immediately wash my hands after I touched whatever I touched. Okay. I'm gonna give her her Aftercare, her little spray bottle of aloe. I'm gonna put this hyaluronic mask on, and then I would, if she could and would let me, I would like to do the LED treatment on her. LED therapy. So that's it, guys. I'm gonna go ahead and start the other half of her. I hope you guys learned something. I'm sure I skipped some things because I'm on camera. But anyway, contact me if you have any questions, if you're interested in receiving the treatment, getting a demo, whatever state you're in. We have lots of reps now. If you want to get a free demo, see what this is all about. Because I met them, I want to say 3 years ago, and I had a different pen, I'm not going to say the name, at the time, and I had great results. And they approached me and I was like, I am not spending thousands of dollars right now, like you guys can screw off. And my friend about a year later had me at her house, and she's like, let me do a treatment on you. And I was like, okay, I'm not going to turn down a free microneedling treatment. Once I saw how consistent, I mean, seriously guys, look at how consistent this is. There's no kitty cat scratches like you saw in that Kim Kardashian picture, like you got attacked by a cat. It is so consistent. Once I saw this and felt it on myself, I literally threw out my other pen. Okay, so if you guys want a demo, I will get you to the closest rep near you, and you can go to them, or they will come to you, and you can get a free demo. And we are always at shows. If I'm ever at the shows, you guys can contact me. You can, if you're in that state at where the show is, contact me. I'll get you in. I'll get you a free demo. Again, thanks guys. Thanks for watching.